Welcome to the IME Community Podcast, where self-love is your superpower to achieve your weight and life goals and make your mark in the world. Your host is Dr. Carla, activist, MD. If you're a teen who's looking to revolutionize your health and can't wait to follow your dreams, welcome to the IME community.
And welcome to the IME Community Podcast. This is Dr. Carl. I'm so excited for this podcast and YouTube video, probably more than I have been for any other one, because I have an amazing guest, Jessie Coffey, who I've worked with forever and who's my awesome friend. So we're going to be talking all things community, but before we get started, I want to encourage you all to check out imecommunity.com if you're a teen 12 to 18 or parent of a teen who's struggling with your weight, struggling with your body image. I know it's really bad during COVID, a lot of pandemic weight gain, a lot of social emotional issues we're worried about. It's a great time to join IME Community and get Dr. Carla coaching. So with that, I'm going to go ahead and launch into our podcast and YouTube video. So this is something I've been wanting to do for a long time. And if you've been listening to the podcast and YouTube and watching the YouTube videos, which I hope you have, and make sure that you like and subscribe and share on Apple and Spotify so that everyone gets all this amazingness. And anyway, you know that I've been doing this work around the childhood obesity epidemic for almost 20 years and on every level. So in 2008, I left my pediatric practice. It was a really tough decision for me. And I love all of the patients and families, and it was so tough to start Teach a Kid to Fish, which is a local nonprofit that I started from scratch. And the vision was creating community solutions for children's health. So ended up building this amazing community collaborative that did work in early childhood and healthcare and the community and in school systems. And it was awesome. And the best part of it was the community partnerships and taking a vision. And the vision was creating community solutions for children's health, mobilizing the community around that, and working with partners like my guest today, Jessie Coffey, again, to really manifest that vision. And you will find if you do this work, which I'm going to encourage you to, and hopefully Jessie and I can encourage you to be a visionary champion in your community on this issue and help you help by sharing some of our challenges and rewards and success that you can, I'm having a little issue with my microphone there. Hopefully it'll be okay. So that you can also do this work and maybe avoid some of the pitfalls, but know where you're going to have impact. But anyway, so what you really need to have success on a community level is partnerships and collaborators who align with your vision for children, for children's health in my case. And so I can't think of anybody else who aligns with my vision and the way that I work and move forward with action than Jessie Coffey. So this is launching the IME Community Solutions for Children's Health podcast and YouTube series, where I'm bringing you all things community. And I believe that community impact is where true change comes from. And community is where our powerful stories come from. And as someone who's done this work on the community level for many years, it's the most rewarding work. It is the most challenging. It is the hardest work you will ever do. It is what you will be the most proud of. And so with that, I'm going to introduce my first guest. So I have to say, Jessie, like, Teach a Kid to Fish, launching a nonprofit was a big investment for my husband and I. And we have so much goodwill and so many amazing memories and so many overwhelming memories of, it was a family thing for you too. Your work has been. But we were reflecting back on some of the most amazing collaborations and partnerships. And then we got to where we refined it and said, like, would it have even existed or been able to exist without these people? And like, who was the top champion? And it was so fun because both of us came up with you. If without Jessie Coffey, we could not have had Teach a Kid to Fish. And it was just so cool because you're always there, and it just makes me get emotional because it's so awesome. And we have to get ourselves together because we have a lot of work to do. But anyway, I just thought you should know that.
Thank you.
And tomorrow I'm interviewing Lynn Sampson, who's the Vice President of Operations, the Food Bank of Lincoln, who's an amazing community activist around food access and child hunger programs. I mean, she's incredible, Bridges Out of Poverty. And when I told her that I was interviewing you first, she said, don't make me go after Jessie Coffey. That's awesome. But let me tell the audience a little bit about you that you shared with me in your bio, and then we'll hear from you. So Jessie has 20 years of experience in public health and is a registered dietitian by training and has a master's degree in family services administration. Jessie has worked in multiple sectors, including state and federal nutrition programs, K through 12 education, and with nonprofits to co-create well-being opportunities that support the equitable promotion of health for all Nebraskans. Jessie works to be a human connector, very true, a lifelong learner, absolutely, and strives to embrace the messiness of life that is at the heart of public health work. She's also a mom and has 3 amazing boys, young men.
I know.
So it's a big part of her life. And they've been a big part of her work too. So welcome, Jessie. I will tell you that I think the first time that you and I, when I started Teach a Kid to Fish and I went to a meeting for Alliance for Healthier Generation, was the first time that I really saw you in action. And I just remember the resistance you got from some of the members of the audience and how you handled it. And that's what you're going to get on the community level. So, so I want you to first tell us a little bit more about yourself and your work.
Sure. So having worked with Lincoln Public Schools for about 13 years, really working with Carla through really a majority of that time to promote health and well-being. There, I learned that that was kind of the space that I wanted to spend a lot more time with, and eventually ended up at the Department of Education to do that sort of statewide, which in my head, I wasn't sure if that would translate from, a local community to is that a possibility to do statewide? And really after about 4 years of connecting with people and learning about what's available, it absolutely is. And so continuing that community work at a state level, but really still having that local connections in our communities. And really we're prioritizing communities that have the highest health disparities and working on some of those equity pieces in sort of a not very welcoming political environment across our state. And really it just speaks to the importance of making sure that we work to support those students and families that need our help the most.
Great, that's incredible. So tell us a little bit more about how COVID has affected your work now.
So I always used to say this, schools have always thought of like wellness and supporting student health, and the nurses have always kind of been on board, but as far as administrators and like looking at youth that are needing additional supports for either chronic conditions or overweight, that it was kind of like a good idea, but not necessarily foundational. And I think what the silver lining to the pandemic has really shown is that health is absolutely foundational to academic success, and we can address it and be effective in a systematic way to make sure that our students feel supported and are healthy and safe at school, or we can kind of ignore it. And then what we're seeing this year with COVID is really those poor educational outcomes just because of COVID and the online learning and some of those things. We had no idea that would be the long-term effects. And so now everyone's really realizing, and Surgeon General's report that was released on Tuesday really outlines that we're in a mental health crisis. So we really need to kind of begin where that crisis outlines and really support that the whole child, physical, mental, social, emotional, the well-being of students and staff.
Mm-hmm. How do you think that we're going to be able to do that? I mean, you and I know, like, it depends on the local champion there. So when you're doing work with schools, I mean, those partnerships are critical. And how do you suggest creating a partnership or, aligning vision for that?
So
work?
one of the best things that we've come across at the NDE is a full service community school model, which LPS did to some degree, but we're really working with a couple communities across the state to roll out that model. So really getting all of those like whole child supports available, making sure that schools know where to connect families with mental health, with if it's dental or vision or vaccinations, that those families know where to be connected in with, or if it's housing, whatever it might be, and that there's that strong relationship within the community to the school. I know sometimes schools are like castles. In the morning, they put the drawbridge down and the kids all come in and they put it up at 8:05, and then community members and families don't feel necessarily really welcome there. And so that full service community school model, which is a national model, really works to make families feel welcome within a school setting, that they're a partner in education and a partner in supporting students' health or whatever needs they may have. And I know there's a lot of different districts doing different things. Working to do telehealth is one of the strategies that's becoming more and more popular that I'm hearing about, especially to address that mental health challenge.
Mm-hmm. And I'm sure that there are such gaps in mental behavioral health services and resources ongoing. Before the pandemic, sometimes what happens is that there's alarm and there's data. We've had all the data, and we've used BMI data and had all the data that shows that we're not getting anywhere and that these are ongoing issues for children and families and communities. And then nothing really happens. And then it falls on the shoulders of the visionary champion. Mm-hmm. So tell me a little bit more about your thoughts on that.
Yes, and schools have always been, very data driven. And so I think it depends really like what data they're looking at. And then we know too, as public health professionals, that like if you're going to track BMI, I mean, that's not going to happen in a year or 2 years. That's, you're looking at a 5-year span of that being something that you can see turning the needle. But really, working with them to make some of those system-wide changes. And really too, if we think about the traditional biomedical model of healthcare versus if we think about it's really if we can change the systems and instead of putting all the onus on the individual, I think that's where you can really make some change. It's still slow. And I know for those students and families that are suffering with some of these challenges right now, that seems maybe not like an adequate response, but definitely I think turning the narrative to systems change to help support the individual.
That's great. So tell us a little bit about like just to go back in time, when you decided to become an RD. And then I've worked with so many RDs who do lots of different things. And so tell us a little bit more about, going to become an RD and all the different work you've been doing.
Sure. So for me, when I was in high school, I was able to shadow a couple different healthcare providers across a couple different settings. And I landed on, wow, I didn't even know a dietitian was a possibility when I had set out to do my shadowing experience, which, by the way, if you're a parent listening and you have a student that's not sure what they want to do, I would recommend working with your high school counselor to set up something like that for your student. It's a really great way to learn about careers. But I found the dietitian role really intriguing because I was shadowing a community dietitian, and that's definitely was the area I liked the best because you were able to help people find everyday solutions to their kind of complex medical problems. probably were beyond their, true understanding of everything. And so I really liked just just being able to work with people, help solutions, help them be healthy. And then when I did my internship and then came back to Lincoln, I started immediately in the community setting because for me, the clinical world in the hospital was a little unfriendly. And so I really liked when I got to engage with folks and develop relationships, and it wasn't just a one and done. People were sitting there with their suitcases on their lap and you're trying to do a diet consult when they weren't quite ready for it. So that's why I really liked the community piece. And started my first job at F Street Recreation Center, where I worked with youth and elderly folks, and we did lots of different nutrition programs for both populations, and really enjoyed that. Worked in the state WIC program, and then went to LPS, and then now I'm at NDE, and I'm really excited to be able to work with such awesome people at the NDE, really people that get the importance of this community work, and that we really need to work to co-construct solutions and not us tell people what they need to do.
I love that, co-construct solutions. What do you think some of the issues were and challenges were with our work? I mean, I can tell you, and I'm sure you'll agree, but when you're on the community level, I love how you're saying co-construct solutions, because a lot of times, it'll fall on one nonprofit and the way the funding paradigms are set up. And when it's not a systems approach, I mean, the burden of sustainability, the burden of everything falls typically like it did on Teach a Kid to Fish, and you feel like the weight of the world on your shoulders. So I think that inhibits a lot of people from doing community work, just all the political stuff you have to deal with. What advice do you have for that?
So yeah, definitely be prepared for the messiness of it. You can have everything, a black and white table all lined out beautifully, and then when you get to where you're going, 3/4 of it won't work for the school, and it isn't because they're being difficult. And I think that we just really have to have an open mind when we work with schools or any other community agency. They know they're experts in their world, so their school, their families, they know them, and so who am I to come from somewhere else and say, oh, I think you should do this? And even though I worked at LPS, I worked at the district level, I didn't work at Huntington Elementary, so the way that we needed to work to create solutions for those families was different than a different school. So I think being very hearing what your population that you're trying to serve has to say, and then being willing to shift and make changes. And I think of the project that we did with Dr. Nelson in Lexington, that we had made a lot of shifts there, but it ended up being I think it worked out really well. We didn't plan it that way, but it ended up that way as we worked with families and to find solutions, and then coaching the community health workers. I thought that was one of my favorite projects that we worked on.
Tell us a little bit more about it. I mean, that was based on a program that you brought to the community called BodyWorks. And we were able to piecemeal funding for many years. And Jessie and I think were the main people implementing BodyWorks. And I counted up one time we had done 20 different runs of, I think it was 6 or 8 weeks or of BodyWorks programming in so many different settings. And you have, like you said, you have to be agile. You have to be learning. It's like a continuous quality improvement, which is the same thing with coaching, or working as a physician as a dietitian too, if you're in the clinical setting, that's how we should be working with our patients. That's how we should be working with our clients, is listening. They know themselves best. The parents know the teen best. So tell us more about BodyWorks and your vision for BodyWorks, some of the things that you learned through that, implementing a multidisciplinary, evidence-based program within the community.
Yes, and you had at one time had this wonderful pyramid graphic where you had the BodyWorks was in the at the top. Was it at the top, right? Yeah.
It was close to the top.
Yeah, closer to the top. So essentially this was an evidence-based program developed by the Office of Women's Health. And the goal of it was for teens or preteens, 12 to 18, where they work. It's a family program. So they work through this 6 to 8 week program to learn about all the dimensions of health and well-being that support a healthy weight, and families, of course, are a huge component of that. And so we did many runs of that program, and it was all, the materials were already developed, so we just had to order them and then recruit families and then implement the project as outlined in the materials. And really, we did a lot of hands-on activities, and families were, I guess, in group with some of the content in the lessons when we did our sessions, because sometimes kids don't listen to their parents, as we all know, sometimes a lot of the time. And so they were able to hear someone else talking about why these are good practices and how that helps support their long-term goal of, whatever that might be for their weight, or even some of the parents' weight too. We had some successes with some of the families, some of the parents as well. And so I know a couple of parents really even explained, like, when you have a teen, sometimes it's hard to find things to come together around. And they looked forward to coming to the sessions because they had that to do together. So but really we started with doing evaluation pieces in partnership with Dr. Nelson at UNL, and having him assist with finding out what we could do better. So success stories and solutions that families then implemented after the program. And really then the work they had their own work the families were to do during the course of the week between each weekly session. And then we had them graduate at the end and then make some next steps.
Yeah. And it was fun. I mean, that was a thing. Like, it was family, it was very behavioral based, and it was fun. And the parents would cook with the kids. I mean, and there was always food or a snack of some sort. And so it was very hands-on. And then also there was activities, physical activities, and they would work toward goals. And some of the measures I remember that were improved were a lot around the health behaviors, because within, you can't significantly decrease BMI always in that time, and we didn't always measure it. I think one of the challenges was recruitment. We always had that issue. We actually had pretty good luck over time, but we found that with the physicians, finding the physician champions, the pediatricians and family physicians who would refer their families, that was really helpful.
Yeah, I think some of really that we had, and then even the partnership with the YMCA, and getting the families in there. And we, so for the physical activity piece, we would have various community partners helping with leading that. And at the Y, we were able to do some free memberships for several months. And then the families actually got to be trained on how to use the equipment, which is very daunting if you've never been to a gym, and maybe it doesn't feel like a super welcoming space until you've been there a few times. And so I thought that was a huge win for families to get access to that and get that like little bit of hands-on training, the Y staff. In addition to the free memberships, was getting that training then on the Y equipment, because that can be kind of, even for me, as I've gone to different gyms, it's kind of a daunting to go into a gym space you're not familiar with, and you feel like people are judging you. And so once you've been there, you've been trained on the equipment, then you feel more comfortable and you're likely to come back more. And they also experienced not only like the workout space, but also they were able to try some of the classes too. So then they knew how those worked and how that setup was. They had youth-based classes, and then families or parents could go at the same time for a Zumba class. So that was fun too.
Yeah, it's cool. I remember the kids, like one of the kids was so excited to see you and gave you a big hug, and was so sad that it was the last night of the sessions.
Yes.
Remember that?
I know, working with kids they're so great. They're so honest with their emotions, and
you're so chill too about it, because there's a lot of, I've been doing on TikTok, as you know, and I knew there was weight stigma and bias in healthcare, but I had no idea until I had like this viral post, and then actually did this article in Kevin MD about it. And Catherine, my daughter, and I wrote up this kind of like qualitative study on it, looking at the trends. But one of the things that I really loved was like, there was just so much compassion. It wasn't like the families would come and you would say, or I would say, like, do this, do that, some of them would show up with their supersize soft drinks. And, you literally just have to kind of laugh and meet people where they are. It's like, they're there. So that's a win.
Right. And then we talked a lot about reasonable like modifications, small steps to be successful. And I know, Carla, one of your big phrases that I still think of all the time as I'm talking to schools is like, we need to give these families a little win. They need a win in their corner. They need something to go their way so they can then be like, that worked. Okay, let's take in the next step for the next win.
Yeah, that's so cool. And I've been learning more about, there's some more research coming out around like self-actualization theory versus like Maslow's hierarchy of needs, which actually wasn't based in science. And so it's really interesting to see, like, especially now with the pandemic, worsening health disparities, all the issues. Families do want what's best. They want to improve their lives. And even if they're in poverty. And so let's help people, let's empower people, let's really meet them where they are to help them do that. So that's really cool. I think one of the challenging things, at least for me, and I know it was for you too, is the funding streams. Okay. In a local community, come on, that is the hardest part of it all.
It is
like getting things funded. And it's like, people say you don't need money. You need some resources. People are experts. I would always say this, we're not chumps here. Like, I'm a pediatrician here, just because I decided to start this nonprofit. And then you're at the whims, it felt like sometimes, of these funders. And the funders will say, they put all the burden of sustainability. And so for Bodyworks, that was sometimes hard. It's like, listen, it's enough. And it's amazing that we helped these, 8 or 10 families have a really amazing time and have some wins in wellness, like you said. And who knows, we can't measure it on a scale, but anyway, I think that was one of the hardest things, but you and I always made it work. We figured it out.
Yeah. And I think too, with that, to your point about community funding and what the funders, are saying and driving the programs, is really, the more I learn about working with communities, is sometimes we need to leave flexibility in there for the community members to tell us what we need. And I know hopefully funders can be okay with the community members or the, end users telling us what solutions they want to find from this given project. And then too, sometimes funders tend to like pit potential community partners against each other because you're both competing for really limited resources. And so that's, a really messy part of that community work as well.
Yeah, it is. It's just the reality of it too. Okay. And tell me a little bit about, what would you say other than that, other than the funding, like, what do you think is the biggest challenge of working on a community level?
Well, now with COVID and the ongoing, challenge of COVID is that, and especially I was thinking about, if Bodyworks, for example, everyone's kind of used to not going to places with, and with bigger groups of people. And so what might that look like if you were to do that sort of thing now in this community? Is it maybe rethinking that, having it a virtual program, half of it virtual, like Tuesday nights you would do the education nutrition piece online, and then you would go to the Y on Thursday nights and work out, like how could you make that work in the world we live in now with COVID, and just the challenges, just to meet people where they're at and understand where they're coming from, and sort of the new normal that we live in.
Yeah, the new normal. Yeah, because it's not going away.
No,
And,
every time we think it's going away, then there's a new reason it's not.
a new variant
Yep.
and something. Okay. So tell me a little bit more about like how do you, because you're a real action taker. And I think one of the things is like, people are afraid of taking action because they have self-doubt, or they have such a pattern of perfectionism that they kind of overproduce it and they don't get to doing the thing. I really think that we really have to step back from overproducing our things and just get it out.
Yes, absolutely. And one of the, yes, the pre-work is important to have it be coherent and organized, but really go out and do that thing, and don't be afraid of making mistakes, because you're really all learning together. And for all the things that went well, when things didn't go well, we learned just as much from that, if not more, and we would change or modify what we did. Like by the time we got to the Fallbrook Y, we were in an FCS kitchen. We were cooking every time they were doing take and bake meals home with them, in addition to what they were making, if we weren't actually cooking a bigger thing. And then they were doing physical activity in a Y space. I mean, that was all an evolution over 4 years of that work. So you have to start somewhere and learn from wherever you start. It's not where you have to end, but don't be afraid to start something, because you never know how amazing it might be.
Yeah, look for the strategic byproducts, all the other things that are going to come that you had, and be open to that. To learn, because I had no idea, like I would get all these amazing partnerships and friendships and stuff, and that's been incredible. Okay, so cool. So what are you most proud of?
Gosh, as I was thinking,
other than
about
your
that,
kids.
Yeah, right, of course. Yes, my kids are great. They, and my older two, and even my younger one at times, but they were with us through much of this work. One of my favorite projects was the farmers market scavenger hunt.
Yes,
that was just, and I actually came across one of those signs not that long ago, and I took it over to Emily, and I was like, look.
Yeah, she did a ton with that too.
Yeah, so I mean, really, and that had a ton of community connections.
Amazing.
So really, it's I think my favorite part of all of the work that I've done, because Nebraska, the public health space is not that big, and so all of the partnerships, all the connections, all the relationships with all the different people. When I go places and do things, or like even when I moved to the NDE, we have had folks come on and I know them from LPS, or I know them from a different place. And so it's really easy to connect back in and then start doing that work together. And so I really think, especially amidst the pandemic and the sort of limited partners or connections that we have sometimes because everyone's remote, that's one of the most important things, of the most important components of the work that we've done, and the work that at the Indy that I continue to do across the state. It's really those relationships and community partners. And
they don't go away. They're individual too. I mean, sometimes you think that they're related to the organizations, but I found this out, that all partnerships are based on the individual relationship. So
yes.
Yeah. That's awesome. So how do you stay with like a positive vision? Okay, so one of the things that you dealt with at Lincoln Public Schools was lots of comments about school lunch. So tell us, and parents talk about that all the time, and the teens I coach, I coach them from all over. They're not in Lincoln, but necessarily, they're like, my school lunch is crap, and then people like to complain about school lunch, and parents like to blame school lunch, and doctors like to attack the chocolate milk. And so, how do you do that too, when you're someone in the community is going to put themselves out there, you're going to get the positive and the negative and the,
Yes. One of my favorite stories about, it was actually at one of our middle schools. They were actually, the students were boycotting lunch. And they were, so because the health class was learning about the lunch and like what you're supposed to eat versus like they felt like what they had available to them, even though there's a lot of behind the scenes of school lunch, there's a lot of regulations that all meet the guidelines, and there's fruits and vegetables offered and things. And so there's a lot for everybody in food service, school food service. It is a very complicated process to get the right items on the menu, meet all of the very strict nutritional requirements. But what that ends up resulting in sometimes is maybe not the food that kids are traditionally used to seeing or what they would like. I know sometimes when we would sit down with kids and ask what they wanted, they were like, lobster, ice cream, soda, so they just like either things that weren't realistic or things that were too expensive to have on the school lunch menu. But really, in that case, we went and sat and talked with the kids and asked them what they wanted, what did they feel was missing. And then we actually partnered with a health teacher to do basically a nutrition education project in the lunchroom where the kids put health information on the tabletops, and then the whole school, and I think that was like 6th grade, did that as part of their, every section of health that day did this nutrition project, and then everybody in the whole school benefited from it. So it was really, again, partnering with those folks and making sure that their voices are heard and that the kids have agency. Mm-hmm. And really that ended up being a positive experience. And that teacher ended up being one of our strongest advocates for the Alliance Project. So that was really awesome.
There you go. Turn it.
Mm-hmm.
So, okay. So tell me a little bit more about fresh fruits and vegetables too in the school, because you did a ton with that.
Yes. So that is one of my favorite programs still across the country. But the fresh fruit and vegetable program is available to schools that are over 50% free and reduced. And so schools are notified at the end of each school year that they're eligible to participate in the following school year, and they fill out a short application, and then they get funding, and it's direct reimbursement. So it's a really nice program, which allows for them to offer things that maybe would have been a little bit more expensive that isn't feasible for the lunch menu, because they're directly reimbursed up to a certain amount. They get a grant every year, and so then they get to use their grant. And so really in LPS, the preschool teachers and some of the younger kids, like the younger grades K through 2, they did such amazing food experiences, and they read books and they did cultural activities, and they learned about coconuts and how they grow and just amazing things. So not only are we exposing children to new foods and allowing them to try it in a very low situation, but they also have the benefit of the positive peer pressure that goes on at school. And then we also after kids got to try things like plums in their classroom for the fruit and vegetable program, when they were offered at lunch, they knew what they were and they would take them and eat them there too. So that was a wonderful second step of that program. But yeah, it was really, you can make that program into as like, you can be as extensive with it, or you can just truly treat it as a snack while you're doing content review with older kids or whatever. But really a great way to help get kids exposed to new things, and then also help them get their fruit and vegetable servings in for the week.
Yeah, that's awesome. And the thing of it is you pushed on it.
Mm-hmm.
You just pushed on it. So where other people see, obstacles or barriers and walls, it was like they don't even exist, which is what you have to be like if you're going to accomplish anything on the community level. Again, it's the most impactful and the most rewarding and the most challenging work, but you got to do it. Okay. So tell me a little bit more about, like I said, I work with tons of RDs, and it's been kind of interesting. And now on social media, looking at the influencers who are RDs, I think there's a lot of confusing messages out there with all the movements. There's body positive, there's health at every size, intuitive eating, dietitians, there's nutritionists, some people are RDs, those, and it's been really, I think, interesting to really learn. And I, find some that I really follow and I recommend that my team members follow. But how do you reconcile that? And tell me a little bit more about, like, I mean, because with the RD profession, and I know you've kind of moved along and do more public health and school health stuff and policy, but definitely has always been an issue. Getting reimbursement has been really tough within healthcare systems unless the patient already has like a comorbidity, unless they're already diabetic, but just for obesity, just for being overweight, for prevention, it's always been an ongoing frustration. And obviously we've needed to change that for a long time. But anyway, just any thoughts on the RD's profession, how they can partner and think about doing this community work?
Yeah. And I know I've heard, other RDs saying, we can't just give our services away, which I agree, for the most part, but I do think it goes all back to those relationships. And so having those first conversations, I don't think you should expect to get necessarily reimbursed right away as you're establishing relationships or having initial conversations, because you need to identify if it's a fit for you, like what you can take on. And then if it matches with your expertise area, but I mean, and then working out sort of, I guess, if you're going to partner with a nonprofit, you have a nonprofit rate versus what you would have if you were going to work with through the reimbursement system. And I know a lot that the Academy of Nutrition and Dietetics is working really hard on the reimbursement process. And in Nebraska, we're working on getting written into some other pieces as well for reimbursement. And there's, more things coming down the pike, and hopefully that will get easier, so that individuals can work with dietitians. We know that the return on investment is really good. When we have individuals working with trained registered dietitians, that the outcomes are improved. And as we potentially move towards a more outcome-based reimbursement system with healthcare, maybe that's where the RD will be able to connect in a bit better, because, we know that physicians get a little bit of nutrition, like one day in medical school, but by and large, referring out. And two, with the pandemic, physicians don't have time to do that. And so being able to feel confident and being connected in their communities with RDs that are available to help support families or youth in that way is very valuable.
And physicians really don't have any training at all, like on motivational interviewing or health behavior change or, coaching or nutrition, and quite frankly, cause a lot of harm.
Mm-hmm.
And so I'm trying to coach them on, like, how do you have those conversations about the BMI and the weight, and just to ask permission first, mm-hmm. as the first thing. And then also for parents of children and teens, after they've had that visit with the doctor, maybe pre-visit, and just say, this is what, they're going to be measuring all these things. I mean, your kid the best, so that may not be a helpful conversation beforehand, but if they're struggling with their weight or they are worried about it, maybe you tell the doctor, the nurse, that they don't want to be weighed, or just get ahead of it with some intentionality, and then how to have the conversation afterwards about like the BMI, or so how to show up as a loving and supportive parent.
Yeah, absolutely. And I feel like too, there needs to be a little conversation about, like, not placing blame on anybody for the situation, because I think a lot of times parents feel frustrated that they're at that situation where they're at where they're at. And, it's likely not for a lack of trying. There's just a lot of things, that, come into play with obesity. And so really just taking that burden off of the parents and letting them know, like, we're looking future forward here. We're wanting to work on solutions and, working to co-create solutions with the youth, things that the youth find reasonable, and that the parents can reasonably support. And everyone's on the same team here. I think those are some of the really important pieces to help families feel supported. Because if they don't feel supported, or that the solutions aren't reasonable, they're not sustainable.
Yeah, they're not even going to try. And then they're going to feel like they failed at that. And then it's just going to make it worse, and they're not going to try anything. Yeah, I agree. Like the guilt and the shame only creates judgment, and then they're gonna be alarmed and want to fix and solve, because even with good intention, you want to do something, and then that's when the harm of the physician who doesn't know how to work with a family on health behavior change causes harm, because then they will maybe try to put their kid on a diet or restrict, and then that's when the damage happens. So anyway, I think that's super helpful advice. I like the co-creating, compassionate, listening. Listen, nobody, let's bust through all the shame here. We live in this society, in this food system, and this pandemic has been tough on all of our health. Okay, awesome. Super helpful. I was going to ask you that about what you would recommend for parents, but tell me, you talked to me a little bit about this with the relationships and partnerships, but like, as far as like, how do you measure success? Because when you're doing the community, what I mean by that is like, okay, so you have a funder who's saying like, and you have all these deliverables with your grant, like this many students, this many schools, this many trainings, this, you know, whatever. Like for me, it was like, how much did their BMI significantly decrease or whatever. But that's not, sometimes it's, you don't control all that, and you can't fix and solve it. And I wish I would have just told them to just, you know what, sometimes, but it's like, how do you get the wins to know that like you keep going, that you're not there to fix and solve these problems, but you're there to show up, decide where you want to put your attentional focus, and feel really good about it.
Yeah. I really think some of it goes back to like collecting those success, like the success, and letting our participants share their story. You know, we all have a story to share, and really by sharing the story, someone told me in the last year, and I can't remember who, you know, whoever's talking is the one that's learning or making meaning out of that experience. So as a dietitian, let's talk less, and let's let our clients, you know, share their story. If it's your first visit, you know, where were they at before? Where did they start? Where are they at now? And then, you know, of course you have to talk a little bit, but really giving our clients a lot of space to share where they're at, where they want to go, and then what they want help with, before we just jump in as like the expert to tell them how we want to fix them or what they need to do.
Yeah, that's super helpful. And for parents too, like what you were just saying, like just less talking, more listening, and then they're going to the child is going to kind of figure it out as they go along. As they're sharing their story.
Knows that there's minimal judgment, you know, being placed by parents. And I know how that is too. Like when a parent or when a teacher emails you, your son's not listening in school or whatever, when they come home and you're like, you know, you're all over them. And I think we need to take a pause as parents and realize that what's the most productive way to address this situation, and pick your battles, and ask them their side of the story, because we know there's three sides to every story, you know, their story, their side, the teacher side, the kid's side, and what really happened. So just, you know, giving the space for that, and letting the kids identify what they did wrong and how they can fix it. You know, again, in their world, their lens is different than ours as parents.
That's great. So stay out of emotional reactivity and fix and solve, and not wanting to deal with it, and being done with it, to just being responsive. Being responsive, loving, supportive, compassionate, and set boundaries and consequences, because I get those notes and calls too, as you know, from and it reminded me of thinking about measures of success, that we have epidemic of like insulin resistance, and I was seeing so much of that in my patients. And then so when I started Teach a Kid to Fish, 4% of US teens were severely obese. When I started the Heroes Clinic, it was 6% is what I was using for the data, severely obese. Pre-pandemic, when I started IME Community, 9%. And probably so much higher even after the pandemic. So one of the things that we saw a lot with BodyWorks, which is great that the families would come, was I remember one of my former patients had been referred, and she had always been overweight, even when she was like a baby, and she was adorable. And I loved her so much, and she's amazing. But she became, really struggled with like even morbid obesity. And, but they came and they showed up and they did it. And then they ended up coming to the clinic, and we weren't able to, I wasn't a coach then, but I think like how we measure the success for her was that she showed up. Maybe that'll be, when she gets to a stage of change on her own sometime, there's so many factors. I know she had a high ACEs score, adverse childhood experience. I know she had trauma. I know she had chronic toxic stress. I know she had a strong genetic risk. I feel like sometimes you can't control for those things, and you just have to feel good about that you have a relationship with her, you believe in her, you're having fun with her, she's got to win.
Yeah, and she gained knowledge and skill, and we know that with youth, having like one supportive adult relationship is protective against some of those ACEs. So even if that was your relationship with her, then she probably looked forward to your visits, and then in 10 years when she is out of maybe that chronic stress environment, she still has those knowledge and skills, and she has that modeled relationship with you, that those are things she can take forward. So those are hard to collect metrics, but still I think should not be discounted.
Yeah, so powerful. And for anyone who is launching any of this community work, to know that you really have to look at all sorts of measures of success, and like you said, be open to those. That's awesome. Okay, so tell me, what's your takeaway message? I mean, what do you think, like after all this work and then moving forward, like what's your vision? Like now for me, my vision is I create community with compassionate connection. That's really what I feel like my purpose in my life is.
Yes. So really too, as I've been working on my PhD and really working at and looking at like that interpersonal communication and the importance of that, and working to co-construct solutions with our participants, and really giving them that voice and that choice. And the more that we can do that, the better. So if you're working with the youth, if you're working with a community partner, if you're working with families, schools, whatever it is, making sure that you go in with an open mind and an open heart. Like you said at the beginning, this is messy work. This is heart work. We're all in this for the right reasons, and not to make millions of dollars. We're here because we care about people and we want to make a difference. And so I think one of the best ways we can outline how much we care about people is, putting them at the center of the work and letting them drive the solutions.
I love it. It's awesome. Okay, so tell me what you do for fun, because a big part of IME Community is to make it fun to get it done. It doesn't have to be grueling to reach a health goal. So what do you do? Not talking about health, but what do you do for fun?
So one of my fun things that I like to do, I'm a big outside person. So we like to go boating in the summer, swimming, and that's mainly family time. And then for my health promotion is I have 2 crazy dogs that I have to take on walks frequently. And so that's one of my favorite times, just to like decompress. It's part of my self-care. Also, my dogs are just, dogs, pets are so much part of that too, and the self-care and the snuggling and all that. So those are family and pets and taking time for me. And those are important things. And I didn't learn about self-care until I think I was like 39.
Yeah.
I'm like, that's a thing. I get to take care of me. Woohoo.
Yeah. Yay, that's awesome. I'm glad you're doing that. Very well deserved and very needed, right? Put your oxygen mask on first.
Yeah.
Okay, so we got a lot of awesome tips. Tell us all where we can find you on social media and where we could contact you.
Sure. So on social media, I am I just want to check. It is at Jessie Coffey too, on Twitter. And then on Facebook, it's you can just find me at Jessie Coffey, and I post a lot of personal and a lot of professional, and on my Facebook, Twitter's a little bit more professional related. So a lot of research, and then also just the latest and greatest information shared out that I collect. So
that's awesome. Yay. Well, thank you so much, Jessie. I appreciate your time and so excited to have ongoing conversations with you. Thanks everyone for joining, and stay tuned for the next IME Community Solutions for Children's Health podcast and YouTube video. Bye.
Thank you for tuning in to the IME Community Podcast, where self-love is your superpower. The content of this podcast represents the opinions of Dr. Carla Lobster and is not intended as, and shall not be understood as, a substitute for professional medical advice, diagnosis, or treatment. The opinions shared reflect the host and guest and do not represent an organization or medical group. Always seek the advice of your physician or therapist if you have concerns about your health. And please, like and subscribe to the IME Community Podcast. Share IME with your friends and go to imecommunity.com to join the member community. Don't forget to follow IME on social.